Hello everyone, welcome to Auricular Medicine webinar brought to you by Lump AccuWellness Foundation Inc. as part of its continuing Lump lecture series. Topics are points of triangular fossa and points of the lobe. The 10 points of the triangular fossa are the points that relate to nervous and hormonal regulation and pelvic organs. Locating the borders of triangular fossa. Remember, the triangular fossa is a depression. It has a slightly darker hue than the tissue of the superior and inferior antihelix crura. During pregnancy and menstruation, triangular fossa is oftentimes bright red. If the patient has painful periods, it tends to be on the dark side. The darker the person's skin, the more difficult it may be to see any pathology, so look closely and practice observation. A simple tip that can help with demarcating triangular fossa's upper border is to gently press the helix of the ear inward in a medial direction. When you do this, superior antihelix crus becomes more visible and elevated, thus making the triangular fossa's upper border clearly demarcated. Now let's discuss the 10 points of the triangular fossa. Shenmen is located in the triangular fossa along the lateral border, superior to the junction of its inferior and superior borders. Place the ear probe in this juncture and then slide superiorly to the intersection. The probe will fall into a small depression. That is the point. Shenmen should be the first point treated in the ear for almost every ear prescription. Noget calls Shenmen the God point. Shenmen enhances vital forces of qi and blood. Point number 2 is stop wheezing, located in the deepest point in the center of the triangular fossa. Place the probe roughly in this vicinity. Search by feel with probe for the depression, which is where the point is located. Stop wheezing is the primary point for treatment of wheezing that accompanies asthma, bronchitis, emphysema. Point number 3 is the hypertension point, located in the lateral superior corner of the triangular fossa. This is an effective point to lower high blood pressure. If the hypertension is due to yang rising with true heat manifestations, bleeding this point is effective. Point number 4 is another point like Shenmen to treat multiple conditions. It is directly related to the regulation of the nervous system, sometimes referred to as autonomic point. There are 3 standard locations of the sympathetic point. One is in the triangular fossa, another is on the posterior border of the helix, and the third is below the triangular fossa. Point number 4 is sympathetic 1, located in the medio-inferior corner of the triangular fossa. Point number 5 is sympathetic 2, located on the posterior border of the helix, midway between the level of sympathetic 1 and sympathetic 3. This is the first of 3 points located on the posterior border of the ear structure. Point number 6 is sympathetic 3, located on the inferior antihelix crus below sympathetic 1. Point number 7 is the uterus or prostate or the seminal vesicle, located midway between sympathetic 1 and hypertension point. This point is very effective for reproductive problems, gynecological disorders like dysmenorrhea, amenorrhea, pelvic inflammatory disease, uterine cysts, fibroid tumors, and infertility. These are treated with the uterus point. For men, this point is used to relieve swelling or contracture of the scrotum for testicular pain and prostate problems. In this case, refer to the point as prostate point. The uterus point is forbidden in pregnancy and may lead to spontaneous miscarriage. Use should be avoided, as should all auricular acupuncture during pregnancy. Point 8 is the constipation point, located on the inferior border of the triangular fossa, the area equivalent to the rectangular shape. Part of it is along the inferior border of the triangular fossa, and part is along the upper portion of the inferior antihelix crus. The constipation point relieves constipation and impacted stools. It can be used to manage diverticulitis, diverticulosis, sluggish bowels. Point number 9 is the hepatitis point, located at the junction of inferior and superior borders of triangular fossa. This is one of the several hepatitis points found in the ear, including point H44. This point helps with hepatitis when used along with the liver, spleen, and other points based upon your diagnosis. Point number 10 is the hip joint, located medial to the hepatitis point on the lower border of triangular fossa. This point effectively relieves hip joint pain due to various etiologies. Now let's go to the points of the lobe, the points of the head and face. Dividing the lobe into sectors. To find points located on the lobe, the upper border of the lobe must be established. Mentally, or using ear probe as a straight edge, draw a horizontal line across the lobe at the level of the lower border of the intertracheal notch that has lip-like cartilaginous shape to it. It is from there that horizontal line is drawn and the upper border of the lobe is created. After locating the upper border of the lobe, divide the lobe into equal thirds vertically and then equal thirds horizontally. This division can be done visually or by using ear probe as a straight edge. 9 sectors are then formed on the lobe. These sectors are universally assigned numbers 1 through 9 as you read from left to right and top to bottom. Points are located in relation to these sectors. Most of these points are defined as in the center of the nth sector. For example, the eye point is located in the center of the 5th sector. Point 11 is the upper teeth, slightly below the center of sector 1. The upper teeth point is for dull, persistent, or painful toothache of the upper teeth. When stimulated with electrical apparatus, upper tooth point is used to anesthetize the upper teeth. Point number 12 is tongue, located in the center of sector 2. This is good for diseases of the tongue, like tongue ulcerations or fissures, speech problems involving tongue, like aphasia, dysphasia, stuttering, deviated tongue that may be a sequela to or a result of stroke. Point number 13 is the jaw point, located at the center of section 3. The jaw point is for problems with the jaw, like clicking, temporomandibular joint syndrome or the TMJ syndrome, aching or dislocated jaw. Point number 14 is the lower teeth point, located center of the sector 4. Similar to upper tooth point, it treats lower teeth. Used as part of acupuncture anesthesia protocol with electrical stimulation for lower tooth problems. Point number 15 is the eye point, located center of sector 5. This is the primary point to treat eye problems like decreased nighttime vision, eye strain, declining vision, myopia, presbyopia, eye twitching. Point number 16 is the inner ear, located center of sector 6. This is good for inner ear problems like impaired hearing, tinnitus, Meniere syndrome, problems of balance, motion sickness like vertigo, seasickness, inner ear infection. Inner ear energetics are similar to body acupuncture point pericardium 6 in regard to balance. Point number 17 is helix 5, located on the lateral border of sector 6. Like all helix points, helix 5 enhances immunity. Point number 18, the tonsil, center of sector 8. The tonsil point pertains to tonsillar tissue, the palatine tonsils in the throat, which ward off infection. Treats tonsillitis. Point number 19 is helix 6, located on the lower margin of sector 8. The energetics are similar to point number 17, helix 5. And finally, we have point number 20, insomnia point, slightly medial to teeth points, numbers 11 and 14, on the horizontal line dividing the upper teeth, number 11, and lower teeth points, number 14. The insomnia point promotes sleep if the point is rubbed gently. The insomnia point may have opposite effect if stimulated too vigorously. Thank you very much for your attention and hope to see you in our next video.